Good day, viewers and listeners. On today's COVID-19 update, Minister of Health Dr. Frank Anthony says all vaccines used in Guyana are safe and effective in protecting against COVID-19.
The best vaccine that you have is the vaccine that you have in your arm, because that vaccine is going to protect you. Vaccines generally, they have different efficacy, and if you judge a vaccine by efficacy, then maybe you can rank vaccines. We are not doing that. What we want to ensure is that people get vaccines that are safe, that are effective, that will protect them. And all the vaccines that we're offering have been proven to be safe, effective, and they're protecting people and saving lives, and we'll continue to do so.
The health minister says to date, more than 68% of the country's adult population have received their first dose.
So numbers-wise, we have 352,932 persons receiving their first dose. These are adults, and that would account for about 68.8% of our adult population. In terms of this second dose for adults, we are now at 182,644. That's about 35.6% of our adult population. In terms of the Pfizer vaccine that we are giving to persons between 12 to 18, so far we have administered 21,815 doses. That's now 29.9% of that age cohort.
The health minister assured that the vaccines are safe for pregnant and breastfeeding mothers to take.
There's no contraindication why pregnant women should not get the vaccine. Initially, the WHO and others were urging some level of caution because there wasn't any availability of data as it relates to pregnant women getting vaccinated with one of the COVID-19 vaccines. That has now changed because you do have a lot of information available now, and almost all the international professional bodies relating to obstetrics are now advising that women during pregnancy must get one of the COVID-19 vaccines. The reason being is that during pregnancy, women are more at risk for COVID, or their risk goes up for COVID, and therefore they should get one of the vaccine. It doesn't matter, you can get it in any one of the trimesters, and therefore we are urging that if you're pregnant, you should take the vaccine. If you're breastfeeding and you haven't gotten the vaccine, you should take the vaccine as well, because with breastfeeding, the antibodies that the mother produces would also help to immunize the baby through the breast milk. So it is a good thing if you can get that vaccine during either during pregnancy or if you're breastfeeding. There's no contraindication to getting the vaccine. So far, a lot of women locally have not been taking the vaccine, and we hope that we can change that, because as you can see on a daily basis, we are seeing a lot of women who are coming into the hospital who have tested positive for COVID.
Minister Anthony noted that since the rollout of the vaccination campaign last March, there has not been any issues of vaccines expiring.
Well, so far we have been able to manage, and we haven't had to dump any expired vaccines because we have been constantly monitoring expiry dates and making sure that we can get those vaccines out.
Minister Anthony is urging persons to take their COVID-19 vaccines as the number of infections continue to rise.
That's it for today's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.